I did want to highlight the importance of ACE inhibitors, particularly in diabetic patients and patients that have hypertension. So understand that hypertension and diabetes both contributes to an increase in the blood pressure within the glomerulus itself. And so this can be exhibited by glomerular hypertension. This also results in an increase in the pressure inside the glomerulus. And so this, from a physiologic standpoint, will contribute to leaky vessels. And so what happens is now you get things that typically were secluded from that barrier being able to now move through that barrier. And the hallmark example of this would be protein. And so the most commonly observed protein, or the most abundant protein in the blood, of course, is albumin. And so we can see albumin leaking now into the urine. And so this produces albuminuria or proteinuria. And when left untreated, it really contributes to the fibrosis of the glomerulus and a reduction in its activity. And of course, when all the glomeruli are affected, you can see renal decline. And so this is really an important treatment component of ACE inhibitors in this special cohort of patients. And then just to recap, remember that your afferent arterioles, when they are vasoconstricted, the outcome is going to be a reduction in GFR. However, when the efferents are vasoconstricted, that will produce an increase in GFR. And so this is really important because this kind of highlights the main uses and contraindications to ACE inhibitors and ARBS. And so in the context of renal hyperperfusion, diabetic nephropathy, hypertension, ACE inhibitors and ARBS, are really beneficial drugs to lower the GFR and reduce the proteinuria episodes or the production of that. However, in the context of hypoperfusion or ischemia, these drugs are actually quite dangerous because the autoregulatory mechanism is inhibited. And that autoregulatory mechanism was shown on the previous slide, where we showed that angiotensin II was responsible for vasoconstriction of the efferent arterioles. And so remember, when you vasoconstrict the efferent arterioles, that's your really only chance to increase GFR. And so in the context of bilateral renal artery stenosis, volume depletion, elderly patients with exacerbated CHF, or just in general renal hypoperfusion, these drugs can be quite dangerous. And so those are just kind of two distinct patient groups I want you to kind of remember as we move forward, just so that you can identify which groups of patients ought to get these drugs and which patients should be contraindicated. Okay, thank you.